My name is Polly Roker, and I work as a biologist, and I've worked for 37 years as a wildlife biologist or in the wildlife field. I have had back pain probably going back to high school. I can remember even in high school in physical therapy or physical education and tumbling and things like that, I had back issues. Everywhere I've lived, I've always gone to a chiropractor. I guess I've lived in several places, and I've had maybe 6 or 7 different chiropractors that sort of kept me in line and helped with the back issues. But just within the last few years, it got to the point that, nothing seemed to help. And I really looked at having back surgery, but I had heard for, many, many times that you don't ever want anybody to operate on your back because they never can get it right. And you're just doomed to more problems. So I guess I sort of bought into that. And then when it got so bad, not only was the back hurting, my primary care physician was giving me a low-level pain medication, and that got to the point where it wasn't helping a whole lot. And then I got radiating pain, and at that time it was like, I've got to do something. So God kind of thing, I stopped to buy tomatoes one day, and this little lady was there, and we started talking about tomatoes and farming, and she said, I said, my husband said he loves to garden, said, but he just got down. He couldn't do it, so he had back surgery. And I thought, good Lord, he's probably a lot older than I am. So I said, well, if you don't mind, what kind of problems did he have? And so she literally told me about this same kind of thing, the symptoms I was having with mine. And I said, I've been thinking a lot about that. And she said, well, honey, you really need to do that. So I walked away and said, that's a little nudge. And I started making a list of doctors that I would see. And I picked the doctors that other people recommended. And I started shopping. I literally shopped. I mean, my philosophy is that if you will shop for a car and you shop for groceries, you better shop for a doctor too, if it's something really serious. A cold or sinus infection is one thing, but when somebody's going to open you up and do radical work on you, you need to shop. Because you graduate from medical school and you're board certified, that does not make you a good doctor. And that's what you're looking for. You're looking for a good doctor. So I literally visited all three different diagnoses. One said, I looked at a old X-ray that I had there, several years old, and he looked and he said, I don't see anything here but osteoarthritis. And you go home and take 2 leaves in the morning and the evening. And then I came out and I saw another doctor, and he took an X-ray, and in 30 minutes he came out, examined me. He took an X-ray and came out with a little piece of paper about the size of a baseball card, very murky, like it had been copied. And he said, you've got a compressed nerve root. And I thought, well, I can't see anything there. So then I left, and then when I came to Dr. McCord, and he put me through all these sophisticated tests, the Upright MRI that I had never heard of. I mean, I'm in the biological area, and I have just never heard of that. But it makes sense, because if your back is hurting when you're standing, that's where they need to be taking X-rays and scans. So we did that, and we did what's called a Discogram, which I don't think any other doctor does, because the insurance companies have put the quietus on those. And after several months, finally he had a diagnosis. He put all of these pictures up on a wall. It just covered half the wall, and he had a picture of all of my vertebrae, the lateral, medial, dorsal, ventral, all parameters of those vertebrae was up on the wall, and he pointed to 2 areas and said, you've got 2 bad discs right here. And he went on to say, and he pointed to them, and I could see it. I mean, and I'm not in the medical field, but I could even look at it and see what he was talking about. And so from that, we had surgery the 19th of December. The surgery in itself and the Dr. McCord will tell you that it's an extreme surgery. I mean, they're going in the front part of you and then the back part of you, and it's a serious surgery. So it's going to take a healing process. And when you wake up, obviously you're in pain, you will have in the hospital an IV that will control the pain, and you're fine. But when you go home, that a lot of that's gone. You've got oral medication, but there is a lot of pain. But it's if you just keep focused on the results of this, you can get through this. If you just do what they tell you, his nurses and everybody that works down there are such a great support system. They really do. They know what they're doing, and if you will do exactly like they tell you, will do well. You will really do well. I went back to work the 1st of January part-time, and by February I was working full-time, and still working full-time, and I'm just almost, each month it gets better. There's a little bit of a pain there starting off, but each month it's getting better and better, so I'm really pleased with it, and I would certainly recommend him, and I already have recommended him to many people.